poor circulation, memory loss, and even heart failure. All of them can begin with something as overlooked as a dry mouth when you wake up. Most people roll over, grab a glass of water, and get on with their morning. But what if that dryness has nothing to do with thirst? What if it is your body sending you a warning it has been sending for months, maybe years, and nobody ever taught you how to read it? Here is something that stops many clinicians in their tracks. Chronic morning dry mouth affects nearly 1 in 3 adults over the age of 60. And in the overwhelming majority of cases, it has absolutely nothing to do with how much water you drank the night before. Nothing. And yet, this is not a conversation happening in most pharmacies. It is not a conversation happening at most annual checkups. It is simply not being had. Stay with me through to the very end of this video, because the number one cause we're going to cover today is something that may be sitting quietly in your medicine cabinet or on your nightstand right now, and it could be doing far more damage than simply drying out your mouth. We are talking about something with the potential to affect your kidneys, your heart, and your brain simultaneously. Welcome to Human Health Zone, the channel dedicated to giving you the real health information that too often gets left out of conversation, especially for adults over 60. If this is the kind of content you need in your life, hit that like button right now, and make sure you subscribe so you never miss a video that could genuinely matter for your health. Now, before we go through all 7 causes, we want to be transparent with you about something. Human Health Zone is a fan channel created purely and only to give credit to Dr. Eric Berg DC, one of the most trusted voices in practical health education for older adults. The insights we share draw on his research, his clinical perspective, and his commitment to cutting through the noise with honest, evidence-based information. And here's a question we want you to sit with until the very end of this video, because the answer is going to change how you look at your medicine cabinet forever. Of all 7 causes we are about to cover, which one is sitting in your home right now, used daily, considered completely safe, and yet maybe accelerating cognitive decline in your brain at this very moment? Hold that question. We will answer it in full before this video ends. Let's talk about what is actually happening inside your body on those mornings when you wake up feeling like your mouth is made of cotton. Your mouth depends on a continuous supply of saliva, and saliva is not simply water. It is a sophisticated biological fluid carrying enzymes, antimicrobial proteins, minerals, and protective compounds that defend your teeth, your gums, your throat, your digestion, and your immune system around the clock. When salivary glands begin to slow down, or when other systems in the body start to struggle, saliva production falls. And when it falls significantly, your mouth dries out, especially overnight, when you are not drinking, not speaking, and not doing anything to stimulate saliva flow naturally. After the age of 60, your body already produces roughly 30 to 40% less saliva than it did in your 40s. That reduction alone creates real vulnerability, but it becomes genuinely dangerous when it combines with the 7 causes we are about to reveal, because none of these causes simply dry out your mouth. Every single one of them is pointing to something deeper happening inside your body. Here is what concerns clinicians most. Chronic dry mouth is associated with a 45% higher risk of systemic infection in adults over 60. Saliva is your mouth's frontline immune defense. Remove it and bacteria, fungi, and viruses gain a direct path into your bloodstream. Before we begin, here is something worth considering personally. How long have you been waking up with a dry mouth? A few weeks? Several months? Years? Leave your answer in the comments below. Your answer helps someone else watching this realize they are not alone in what they are experiencing. Let us go through all 7, from the least serious to the one that concerns us most. Number 7 on the list is the most common cause and also the most dismissed: mouth breathing during sleep. Before you move past this one thinking it is obvious or harmless, there is something important you need to hear. Mouth breathing during sleep is almost never just a habit. In clinical experience, it is nearly always a symptom of something else going on, and that distinction matters enormously. When you breathe through your mouth, air moves directly across your tongue, your palate, and the back of your throat. That constant airflow evaporates moisture at a rate your salivary glands simply cannot keep pace with while you sleep. The result is that sandpaper feeling when you wake up, cracked lips, a thicker coated tongue, sometimes a sore throat that has nothing to do with any illness. But here's the part that goes far beyond the dry mouth itself. Mouth breathing during sleep is frequently driven by nasal congestion, a deviated septum, nasal polyps, or sleep apnea. And sleep apnea in particular is not something to wave away. Research shows that untreated sleep apnea is linked to a 60% increased risk of stroke and a 40% increased risk of heart failure. If you're waking up dry-mouthed and you also snore, feel unrest after a full night's sleep, or if someone close to you has noticed you sometimes stop breathing during the night, please do not file that away as just the way you sleep. Speak with your doctor about a sleep study. That single conversation could matter more than you realize. For those whose mouth breathing is not connected to sleep apnea, the practical solutions are straightforward and effective. A nasal strip worn across the bridge of the nose before bed can increase nasal airflow significantly, encouraging the body to breathe the way it was designed to. A humidifier in the bedroom, set between 40 and 50% humidity, reduces overnight moisture loss dramatically. Switching to a side sleeping position reduces a tendency to breathe through the mouth. And a small strip of surgical tape placed vertically over the lips before sleep, something sleep specialists have used for years, gently trains mouth breathers back toward nasal breathing. Many people notice a real difference within the first week. Number 6 is a mistake most people make, and it is one that feels completely logical until you understand why it does not work. Most people who wake up with a dry mouth assume the fix is simple. Drink more water before bed. So they do exactly that. They finish a large glass right before they turn the light off, and they wake up just as dry as before, sometimes even more frustrated because they did everything right and nothing changed. Here's why. Your body does not hydrate in real time. When you drink water, it takes between 30 minutes and 2 hours for that fluid to be absorbed, distributed to your tissues, and made available for functions like saliva production. Water consumed at 10 at night is doing very little for your mouth at 6 the next morning. The window has already closed. The real problem is what happened, or did not happen, in the afternoon. Research found that adults over 60 who did not maintain adequate fluid intake between noon and 4 in the afternoon were 62% more likely to experience significant overnight dry mouth compared to those who stayed consistently hydrated throughout the day. 62%. That is not a small difference. And after 60, this becomes harder to manage naturally because the body's thirst mechanism becomes genuinely less reliable with age. You can be meaningfully dehydrated and feel no particular urge to drink. Many people also quietly reduce afternoon fluids to avoid nighttime bathroom trips, which is completely understandable, but it creates a hydration deficit that peaks precisely when there is no way to correct it. The solution is not more water at night. It is front-loading hydration earlier. Aim for 6 to 8 ounces with every meal and every afternoon snack. And here is a small but effective practical tip. Add a pinch of sea salt and a squeeze of lemon to afternoon water. This supports electrolyte balance, helping cells actually hold on to the fluid you consume rather than letting it pass straight through. Pay close attention to number 5, because this one catches almost everyone off guard. We rarely think about nutrition as a direct cause of something happening in your mouth every single morning. Your salivary glands are not passive structures. They are metabolically active tissues that require specific nutrients to function properly at the cellular level, and 2 particular deficiencies tear through salivary gland function in adults over 60 faster than almost anything else. The first is vitamin A. This nutrient is essential for maintaining the health and integrity of every mucous membrane in your body, including the lining of your mouth, your throat, your nasal passages, and your digestive tract. When vitamin A levels fall, those membranes become thinner, drier, and progressively less functional. Research found that adults over 60 with low vitamin A levels showed a 41% reduction in resting saliva production compared to those with adequate levels. That is not a subtle effect. That is your salivary glands running on a fraction of their capacity. The second is the B vitamins, specifically B3, known as niacin and B12. Niacin deficiency directly disrupts the nervous system signals that trigger saliva production in the first place. B12 deficiency causes the tongue to become inflamed, abnormally smooth, and persistently dry, a condition called glossitis. Together, they create a dry mouth that no amount of water will fully resolve, because the problem is not hydration. It is cellular function. After 60, B12 absorption drops significantly due to reduced stomach acid production, and research suggests up to 30% of older adults have inadequate B12 levels without any awareness of it whatsoever. For dietary sources, focus on sweet potatoes, dark leafy greens, and eggs for vitamin A, and lean meats, fish, and dairy for B12. For many adults over 60, supplementation is also necessary. Look for AB complex containing at least 1,000 micrograms of B12 in methylcobalamin form, the most bioavailable version available. And one practical tip: vitamin A is fat-soluble, meaning it absorbs far more effectively when consumed alongside a small amount of healthy fat, a drizzle of olive oil, or a few slices of avocado. With a meal, makes a genuine difference. Before we continue, a brief and important note. Everything shared in this video is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you are experiencing any of the symptoms discussed today, please consult with a licensed physician or healthcare provider. Only your doctor can evaluate your personal health situation and recommend the appropriate course of action. Number 4 is a combination that warrants the most serious attention. If you're waking up with a dry mouth and you are also getting up to urinate more than once during the night, that pairing is a clinical warning flag that should not be ignored. Together, those two symptoms are among the earliest signs of uncontrolled blood sugar, and in some cases, undiagnosed type 2 diabetes. Here is the mechanism. When blood sugar climbs above a certain threshold, the kidneys work overtime to filter and excrete the excess glucose. To do that, they pull water from the body's tissues. That internal fluid loss dehydrates you from the inside out, and one of the first places you feel it is in your mouth overnight, when there is nothing you can do to compensate. What makes this so important is the timeline. Research found that morning dry mouth was reported by 63% of adults newly diagnosed with type 2 diabetes, and that most of them have been experiencing that symptom for over a year before their diagnosis. Over a year of their body signaling something was wrong every single morning. Dr. Eric Berg DC has spoken directly about this in his clinical work. Patients who came in about something else entirely mentioned the dry mouth almost as an afterthought, and through careful questioning, a picture emerged that led to a diabetes diagnosis that changed the course of their health. Was the patient getting up at night to use the bathroom? Yes. Unusual afternoon fatigue? Yes. A fasting blood glucose panel that week revealed type 2 diabetes. Lived with unknowingly for well over a year. Within 4 months of targeted dietary changes, daily movement, and supplementation with berberine and magnesium glycinate, fasting glucose had normalized. That is what catching something early looks like. Not a crisis, an opportunity. Number 3 is a condition that affects approximately 4 million Americans, and yet the average patient waits nearly 3 years from the moment their symptoms begin to the moment they finally receive a diagnosis. That is not a gap in medicine. That is a gap in the conversations happening inside examination rooms. The condition is called Sjögren syndrome. It is an autoimmune disorder in which the immune system mistakenly targets the body's own moisture-producing glands, primarily the salivary glands and the tear glands. The result is persistent dry mouth, chronic dry eyes, difficulty swallowing, and in more advanced cases, systemic involvement, including joint pain, fatigue, and effects on the kidneys and lungs. Women over 60 are disproportionately affected, representing nearly 90% of diagnosed cases. So why does it take so long to identify? Because each symptom gets treated in isolation. The dry mouth gets dismissed as aging or dehydration. The dry eyes get attributed to screen time or seasonal allergies. The joint pain gets labeled as arthritis. No single doctor connects the dots, and the underlying autoimmune process continues unchecked the entire time. The diagnostic clue to carry with you is this. If your dry mouth is consistently accompanied by eyes that feel dry, gritty, or burning, and particularly if you're a woman over 60, ask your doctor specifically about Sjögren syndrome by name. A blood test measuring 2 specific antibodies, anti-SS A and anti-SS B, can identify the condition in most cases. You are entitled to ask for that test. Do not wait for someone to offer it. There is no cure for Sjögren's, but there are effective treatments that manage symptoms and slow progression significantly. And for immediate relief while you seek answers, sugar-free gum containing xylitol is one of the most accessible tools available without a prescription. It stimulates saliva production and simultaneously inhibits the decay-causing bacteria that dry mouth encourages. Number 2 is not one most people would ever connect to a dry mouth, but the link is real, it is documented, and every adult over 60 deserves to know about it. Your salivary glands do not operate independently. They are governed by the autonomic nervous system, specifically the parasympathetic branch, which oversees the body's rest, recovery, and digestive functions. When that system becomes compromised, salivary activity declines. The mouth dries out. What makes this so significant is that autonomic nervous system dysfunction is a recognized early feature of Parkinson's disease and Lewy body dementia, and research has shown that these autonomic changes can appear 4 to 6 years before the classical motor symptoms that typically lead to a diagnosis. This is not a small window. It is potentially a life-changing one. Dr. Eric Berg DC has highlighted in his work how often early neurological signals go unrecognized precisely because they appear in systems we do not immediately associate with brain health. Think about that for a moment. A patient presented with persistent dry mouth across multiple visits, with the obvious explanations already ruled out: medications, sleep position, hydration. Nothing fully resolving it. Then, in one appointment, a family member mentions almost in passing that the patient has stopped recognizing the smell of their morning coffee. They noticed it too, but said nothing, assuming it was unrelated. It was not unrelated. A referral to a neurologist, and imaging confirmed early Parkinson's disease. Because it was found early, neuroprotective therapy could begin, and a care plan built well before significant motor symptoms developed. 3 years later, quality of life remained genuinely good. The patient later said, "I almost did not mention the dry mouth. I thought it was too small to bring up." Nothing is too small to bring up. Your body is always communicating. Our job, yours and ours together, is to learn how to listen. And now, the moment we promised you at the start of this video, we asked you to hold a question. Of all 7 causes, which one is sitting in your home right now, used daily, considered completely safe, and yet maybe accelerating cognitive decline in your brain at this very moment? The answer is number 1 on our list, and it is a cause encountered most frequently and most consistently overlooked, most poorly communicated, and most deserving of a direct and honest conversation. Over 500 commonly prescribed medications list dry mouth as a side effect. Over 500. For adults over 60 who take an average of 5 or more prescriptions daily, the cumulative impact on salivary function and on brain health can be profound. The drug classes most frequently responsible include antihistamines, antidepressants, blood pressure medications, bladder medications, antipsychotics, and certain pain medications, including muscle relaxants. What makes this genuinely dangerous is a concept called anticholinergic burden, the cumulative neurological effect of multiple medications that block acetylcholine, a key neurotransmitter. High anticholinergic burden has been linked in multiple large studies to accelerated cognitive decline and significantly elevated dementia risk. The dry mouth is not the endpoint. It is the visible signal of something happening much deeper. Dr. Eric Berg DC has spoken about patients who describe waking up every morning feeling like they had swallowed chalk on the same medication combination for years, with no single prescribing doctor ever reviewing the full list together. A medication reconciliation identified 2 drugs with overlapping anticholinergic effects, both of which had safer alternatives. 2 substitutions were made. Within weeks, the difference was noticeable. Within 2 months, the patient reported waking up feeling like a normal person again, with thinking sharper than it had been in years. That was not coincidence. That was the body responding to the removal of a burden it had been carrying silently for a long time. Here is your action plan, starting tonight. Stop any over-the-counter sleep aid containing diphenhydramine. Melatonin at 0.5 to 1 milligram is a far gentler alternative. Run a humidifier at 40 to 50% humidity. Front-load your hydration through the afternoon. Brush with a fluoride toothpaste formulated for dry mouth before bed. And try a nasal strip tonight. Then, this week, write down every single medication you take and bring that list to your doctor. Ask directly, do any of these suppress saliva production? And is there an alternative? You are not broken. Your information has simply been incomplete. And starting right now, that changes. If this video helped you, smash that like button, Subscribe to Human Health Zone for more real health solutions built specifically for adults over 60, and turn on notifications so you never miss a video. Share this with someone you care about, a friend, a family member, a spouse. You may just give them the piece of information that changes everything. Which of these 7 causes surprised you most? Which one made you think, that might be me? Leave your answer in the comments below. And if you personally wake up with a dry mouth, tell us how long it has been happening. Your story matters, and it may be the thing that helps someone else finally take action. And one last thing, drop a comment letting us know which city or country you are watching from. We have viewers from all around the world, and we love hearing from every one of you. Take care of yourself, and we will see you in the next video.